Redigoat is a small coastal village located at about 35 kilometers southeast of Karachi. It has a population of 50,000 people. Their main source of income is fishing. Majority of these people are poor and illiterate. There are no schools or hospitals in the area. There is one qualified doctor and 7 quacks serving the whole village. There are no facilities for medical emergencies, including obstetric care. They have to take patients all the way to Karachi in hired transports in case of emergencies. Close proximity to Karachi and added advantage of rural setting with poverty, disease and lack of healthcare facilities makes it an attractive site for researchers. For the last 5 years, several NGOs and researchers from both community and clinical sciences have carried out different projects in the area. These range from cross-sectional surveys to prospective randomized controlled trials. Currently, there is a prospective trial going on which randomizes low birth weight infants to control arm receiving placebo and study arm receiving micronutrient supplements. Outcome measures include changes in anthropometric parameters and blood indices. This is a study in vulnerable population as its research subjects are infants of poor and illiterate community. We set out to explore how the informed consent was being administered, who was consenting, and how much did the people understand about the study. There are 2 research medical officers, 12 community health workers, and 1 lady health visitor who administer the consent. We started with the president of the Redigoat community and asked him what he understood about the project and the issues related to informed consent. ये जो लो बर्थ वेट स्टडी चल रही है, इसके बारे में आपको क्या मालूमात है असल में?
ये हमें इतना मालूम है, इन लोगों को हमने पूछा कि ये क्या प्रोजेक्ट है, क्या बात होगी इसमें, तो उन्होंने बोला कि ये देखो जो बच्चे पैदा होते हैं कम वजन वाले बच्चे, तो हम इसको देखेंगे कि ये कम वजन वाले बच्चे हैं तो इसमें खून की कमी तो नहीं है, ग़िज़ा की कमी तो नहीं है, और हामला औरतें जो है उनको हम चेक करेंगे, उसका खून टेस्ट करेंगे कि इसके खून में कोई चीज़ तो नहीं है, ताकि इसको हम दवाएं दें, उसकी हम जो इलाज करें, ताकि वो जब माँ सेहतमंद होगी तो बच्चा खुद सेहतमंद हो जाएगा, माँ बीमार होगी तो बच्चा खुद ब खुद बीमार हो जाएगा। इसके इतना ही हमें पता है, बाकी तो डॉक्टर लोग इसको जानते हैं कि क्या इसमें चीज़ है क्या नहीं।
जो इसमें ब्लड टेस्ट इन्होंने लिए उसके नताइज आपको बताए गए हैं कि ये ब्लड टेस्ट लिए हैं, ये किस चीज़ के लिए लिए गए हैं और इसका आगे जाके इसके नताइज क्या हैं और इसका इनको और आपको क्या फ़ायदा होगा?
ये टेस्ट तो इन्होंने लिए हैं, तकरीबन मेरे ख्याल में बहुत से टेस्ट लिए हैं और वापस इनको रिपोर्ट मिल चुकी है। जो भी रिपोर्ट देते हैं उसको बोलते हैं कि आपको समझिए इसमें खून में ये चीज़ है, ये चीज़ है, ये डॉक्टर लोग बताते हैं। हम ज़्यादा उसको नहीं पूछते कि भाई इसमें क्या हो, जो जिसका खून जिसका टेस्ट हुआ वो खुद ले जाते हैं। उन्हीं को बताते होंगे, हमें नहीं बताते।
जो तहकीक होती है इसकी आप लोग जो इजाज़त है वो कम्युनिटी देती है, कम्युनिटी के बड़े लोग देते हैं, या अलग अलग हर एक से इजाज़त ली जाती है? किस तरह आप समझते हैं होती है और किस तरह होनी चाहिए?
हाँ, ये भी एक अहम सवाल आपने उठाया। ये मसला ये है कि हम तो कमेटी के लीडर हैं, कम्युनिटी के लीडर हैं। जो भी प्रोजेक्ट आता है या जो भी समझे फीचर होती है, ये हमें बता दें कि भाई हम पहले उनको पूछते हैं कि ये बंदा आया किस लिए आया, क्यों आया, तो ये बताते कि ये भाई ये प्रोजेक्ट शुरू होने वाला है, इसमें ये चीज़ें होंगी, ये सर्वे करेंगे, ये खून टेस्ट करेंगे, ये करेंगे। तो उसमें लेडीज़ जाएंगी, इनके साथ लड़के भी होंगे, वो बाहर खड़े रहेंगे, और लेडीज़ का काम होगा तो लेडीज़ से ये बात लेडीज़ कर लेंगी, और मर्दों का काम होगा तो मर्दों से बात कर लेंगे। तो इसके लिए आप उनसे तावन करें।
आपके ख्याल में इज्तिमाई इजाज़तनामे के अलावा इनको अलग अलग भी लोगों से पूछना चाहिए जाके, और सारी तफसील बतानी चाहिए तहकीक के बारे में, सारी तफसील, या सिर्फ ये बता देना चाहिए कि हम उस तहकीक के लिए आए हैं जिसके लिए आपके बड़े लोगों ने इजाज़त दे दी है, तो वो काफ़ी है?
नहीं, उसको समझाना चाहिए। मेरे
आपकी राय में या आपके इल्म में ऐसा है कि लोगों को मालूम है पूरी तफसील कि ये तहकीक किस बारे में हो रही है और इसके क्या फ़ायदे हैं, क्या नुकसानात हैं, और उनको क्या फ़ायदे हैं, दूसरे लोगों को क्या फ़ायदे हैं, जो डॉक्टर हैं उनको फ़ायदे कितने हैं, जो लोग इस तहकीक में शामिल हैं उनको क्या फ़ायदे हैं?
मेरे ख्याल में तो इन लोगों को पूरी तरह बताना चाहिए इनको। हाँ, ये शायद ये तो हमको तो ये हम बोलते हैं कि आपको घर में गए आपको क्या रिपोर्ट मिली, बोलेंगे हमने तो उनको समझा दिया, हमने ये कर दिया, तो हमें जब शिकायत नहीं मिलती है तो हम पूछते भी नहीं।
अगर कुछ फ़र्द या ख़ानदान के लोग चाहें कि हम इस तहकीक में शामिल नहीं होना चाहते, तो उस सूरत में कम्युनिटी के बड़ों की और मोहल्ले वालों की या गांव वालों की क्या राय होती है? क्या वो इतनी उनको आज़ादी होती है कि वो इस चीज़ को मना कर सकें और उस मना करने पे उनको कोई नुकसान नहीं होगा?
नहीं, हम तो पहले तो ये करेंगे, उसको जाके पूछेंगे कि भाई ये फला बंदे आए थे आपके पास, तो आपको क्या तकलीफ पहुंची, कोई दुश्मनी या इन्होंने कोई गलत कदम उठाया? अगर जो भी शिकायत है तो आप हमें बोल दें, फिर हम उससे पूछ लेते हैं। वो बोलते नहीं कोई बात मसला नहीं है, तो हम बोलते तो मसला नहीं है तो फिर आप क्यों मना करते हैं, कोई तकलीफ कोई वजह बता दें। बोलते नहीं हम नहीं करने देते हैं, तो फिर हम इनको बोलते हैं जो नहीं करने देते उनके पास नहीं जाओ।
आपके ख्याल में जबर नहीं होता इस चीज़ में? बिल्कुल आज़ादी से करते हैं जो कुछ लोग करते हैं।
बिल्कुल कोई जबर नहीं है, न हम उससे ज़बरदस्ती करते हैं। हम उनको सिर्फ बता देंगे ये आपके भले के लिए, इसमें आपका फ़ायदा है, नुकसान नहीं है। अगर नुकसान हो तो फिर आप शिकायत कर ले हमसे, तो फिर हम उसका हवाला कर देंगे, हम इनको पकड़ लेंगे कि ये नुकसान क्यों किया। जब कोई नुकसान नहीं है, आपके भले के और फायदे के लिए है, तो आप उसको करने दें। फिर भी वो नहीं करने दे तो हम लोग इन लोगों को कहते हैं कि बस छोड़ दे, फिर उसको भले उसको अपना नुकसान हो जाएगा, बाद में खुद ब खुद आ जाएंगे ये लोग। जब उसको पता पड़ेगा, उसको इसका एहसास होगा कि वाकई फला बंधु ने ये काम अच्छा किया, अच्छा करे, तो खुद ब खुद आ जाएंगे।
आपके ख्याल में या माशरे में या आपके गांव में इतनी औरतों को आज़ादी है कि वो अगर चाहें तो मना कर सकती हैं किसी चीज़ को?
ये एक ऐसी बात है कि हर घर में एक बड़ा तो होता ही है, फैसला वही बड़ा करेगा। अब आज़ादी के हवाले से आपने जो बात की, तो पहले का ज़माना गुजर चुका था, जो औरतें घर में बैठी होती थी कि एक औरत मर रही है, लेकिन बोले कि इसके घर वाला किधर काम पे गया हुआ, जब वो आएगा तब इसका इलाज होगा। ये अब बात खत्म हो गई कि इतनी आज़ादी उनको मिल चुकी है, वो अपना समझे इलाज करवा सकते हैं, किधर जा सकते हैं, आ सकते हैं। लेकिन कोई पंचायती मसला या कोई ऐसा मसला तो उसमें मुदाखलत नहीं कर सकते। अगर करेगी तो उसको पंचायत में बुलाएंगे कि आपने क्यों ये मना किया। जो फैसला पंचायत करेगी, जो बड़े करेंगे वही होगा।
लेकिन फैसला इज्तिमाई होता है हमेशा।
बिल्कुल इज्तिमाई होता है, अकेले के नहीं होता। पूरे मेले के लोग जमा होकर करेंगे भाई ये फैसला अच्छा है, अब इसमें सबकी भलाई है, तो उसी को कायम करने की। एक बंदा बोले तो वो गलत कर रहा है तो उसको बोलेंगे ये गलत है।
Then we met the research subjects and started with the wife of a community leader, as she was thought to be most informed. We asked her, what do you know about the study?
એને બારે તો કેડી છા ખબર
I don't know anything.
જેકને તો
When you don't know about the study, then why do you consent for it?
વસન કરના અભિષેક
They have come to my house. How can I refuse?
Can you refuse if you want to?
No.
We visited another contrasting home where the mother believes that the medicines are not helping her child.
My child is not benefiting despite the medicines.
Do you know that some children may not be getting the medicine?
दवाई नहीं होती है उसके अंदर, ये आपको पता है?
No, but my child is getting the medicines without any benefit.
आपके ख्याल में दवा है इसमें?
अब दवा ने फायदो નથી દે
Then we meet the mother who is very happy with the project. Did they take your permission to put you on the project?
Yes.
What permission did they take?
I went to the center. They checked me, took my blood and gave medicines
Why did they do the blood tests?
to treat my illness and swelling.
બીમારી સોજ
बीमारी के लिए कर रहे हैं।
હા
आपको क्या फायदा होगा इससे?
इलाही फ़ाइदो थियो
फायदा हुआ आपको?
हा आराम जूं गोरियूं ॾिनूं ॿियो कारियूं ताक़त जूं गोरियूं ॾिनूं न
अच्छा,
दवायूं ॾिनियूं पोइ तंहिं तां फ़ाइदो पई वियो इलाही
तो आपसे जो खून लिया उसका क्या करेंगे ये?
खून टेस्ट हे खून वठण आई आहियूं
हाँ, खून का क्या होता है? खून का क्या करते हैं?
पोइ खून जो वरी रिपोर्ट त कोन मिलियो
रिपोर्ट नहीं मिली आपको खून
न
की? लेकिन आपको दवाइयाँ दी हैं इन्होंने?
हा दवा मिली हुई
अगर आप
What if you refuse to participate?
हमने चेक करा
I don't want to refuse.
त कोन थिया
Would you come to any harm if you refuse?
If I don't give blood,
दवायूं कोन
I won't get the medicines.
Do you understand the difference between treatment and research?
ज़रूर
Yes, the medicines are good.
तंहिं तां ख़ासियो थींदो
But
Then we visit a relatively more aware mother.
do they take consent before filling the forms? Yes.
क्या इजाज़त ली
What did they ask? They say it's good for you. Is it treatment?
ये क्या आपका इलाज
They said we will give medicines for your children.
अच्छा है।
दवाई अब बच्चों को मिलेगी।
आपके आपके
What is
ख्याल से
the
इसका क्या
benefit
फायदा
of this project?
फायदा है
क्या फायदा है
हमारे
Our
बच्चे
children are
ये
growing
दवाई
much
मिलेगी
better
बच्चे
ever since the treatment has started.
ये इलाज और तहकीक में
Do you understand the difference between treatment and research? Yes. What do you
जो
understand?
बच्चे पहले हमारे ज्यादा
Children
पढ़ते
grew
थे, अभी
poorly
ये दवा
before the
मिल रही
project
है, तो
started.
वर्ग
Now they are much
ज्यादा
better.
उसको मिल रही है।
ये आए आपसे बात करने और वो फॉर्म भरने और आप
What if you refuse the
तो
consent?
क्या होगा
If I refuse,
आपका फायदा
will
है,
it be
नुकसान है
helpful or harmful?
नुकसान है,
क्या नुकसान है?
Harmful.
दवाई नहीं
If
मिलेगी।
I refuse, I won't get any medicines.
बच्चा है बच्चे को दवाई देते हैं पिलाने के लिए दवाई
Do you think all children are receiving the same medicines?
या फर्क है कुछ
Yes, all are the same.
सारे बच्चों की तो हमने देखी नहीं है,
मगर
Do you know that the medicines can be
दवाई
different?
फर्क भी हो सकती
No,
है
we
या नहीं
don't
हो
know.
सकती
हमें ये पता नहीं है।
Then we interviewed the community health workers who mainly administer the informed consent.
पूछते हैं
When you take consent, do you tell them the details of the project
इसके क्या फायदे हैं
and what's
इसको
in the
किसको
syrup?
फायदा हो रहा है, इसको क्या नुकसान है
What are the advantages
दवाई
and
में क्या
disadvantages
शामिल है?
to the
दवाई
participants?
सबको एक जैसी मिल रही है या किसी को मुख्तलिफ दवाई मिल रही है, ये सारी चीजें तफसील बताती हैं आप?
Yes, we tell them that for low birth weight infants we will give medicines and it will benefit their children.
ये तो सबको एक ही जैसी मिलती हैं जो कमज़ोर बच्चे होते हैं और ये
Do you know that a placebo is being used in half of the
दोनों में से
participants?
किसी एक दवाई में शायद दवाई शामिल ना हो, ये आपको पता है?
No.
Then we asked the research medical officers about their views on the process of informed consent. During the day when we asked the research subjects, the community workers, the community elders and the community leaders, nobody is aware that this is a randomized control trial, placebo control trial. This is a randomized placebo control trial. Do you think that this is misunderstanding, or this message has not been communicated, or if this message would have been communicated, this would have resulted in people not participating in the study?
Actually, we also are not aware of the randomization, so we are also not aware of the which medicine contains the actual drugs and which is the placebo.
That is true, but you are you know that this is a randomized placebo control trial. Somebody is getting no medicine.
Yes.
You know that. Yes. That's one of the patients, one of the two patients will not get the medicine. Yes. That you know. That's randomization. Yes. But the patients and the community and nobody is aware of that.
Yes, it is true.
But why? I mean, they should know. They ought to know. That's their right to know.
Actually, the community leaders know these things, but the community also don't bother to be aware of this type of things. And some of the community leaders also know that some of the children are not getting the medicine of this micronutrients. The leaders know.
But don't you think, as a researcher, it is your responsibility that they should know when they are consenting? Before that, they should know that they are picking up a draw in which one person will not get the medicine, and their child could be one of them who is not getting the medicine.
Yes, you are right.
The other issue is about the blood tests. The people are not aware of the blood tests as to why these blood tests are done, except for hemoglobin. And even the community health workers are not aware of this. The community elders are also not aware of this. That there are other samples which are being taken, which will be tested for certain other micronutrients, which I know that you do not also know the results. But don't you think that they should know that other blood tests are being done? There is, what we find is that there is deficiency of information somewhere. It's not being properly communicated to the research subject.
Yes, you are true that we are also performing other tests also of the iron and folic acid, iron, vitamin A, vitamin D and copper and zinc. Actually, I think so that especially vitamin A analyzing nowadays, because it needs a lot of money and a lot of things. The idea was that we will, when we have a lot of specimens, we can run this on the in a short time, so we can save the kits. The kits are very costly, I think.
Finally, we raise the issues of informed consent with its attending problems of administration in developing countries with the principal investigator.
Issue of informed consent, particularly when one is doing studies as in areas like Rarigod, where the population is by and large illiterate, and it's a very patriarchal society with controls largely administered by the elders or male members of the community, is not an easy one, and it's something that every investigator has to contend with at the initial stage of the design of the project. Now, the community elders or community CBO, community-based organization, by and large acts as a gatekeeper to the community. And therefore, in terms of their inclusion in the process of planning of the study or their acquisitions to become part of the study is something that's done at a very early stage. So in terms of the overall community's consent to be a part of an experimental protocol or a project, this process is a negotiation that's done with the community through its representatives. Now, a natural question always comes, does the community-based organization truly represent the community? And do they have a downstream process whereby they take your desires and your agenda and discuss it with the community at large? Unfortunately, that process is very variable. As far as Ready Goat is concerned, we were reasonably confident that the community that we spoke to, the community-based organizers that we spoke to, represented all sections of the community, because there were definitely 2 or 3 parties, 2 or 3 ethnic clans within them. So they were by and large representative of the society. The study was therefore discussed with them as a possibility, and it was presented to them exactly the way it was designed, in that here would be a project in which some children would receive one form of an intervention, others would receive another form of an intervention, and several components in that study, such as, for example, the permission to give blood samples, would be totally voluntary. For example, if a mother did not want to give a blood sample, a pregnant woman did not want to give a blood sample, or did not want her baby sampled, she had the right to say no, and this was made very implicitly clear. We did spend a fair amount of time in telling them why the study was important, both from a national point of view and also in terms of its implications for global public health policy. I'm uncertain if those details of the study were actually transmitted to the community members at a grassroots level, or communicated in a way that would have made sense. In one of my other projects, I had taken the prerogative of speaking to the community directly, with permission of the community-based organization. When we attempted to do that at Ready Goat, for example, we were told very clearly that it was unnecessary, and that the community would not, number one, be able to organize something like this, and that they themselves were quite capable and willing to tell the community members what the whole thing was about. And I think it did happen to a certain extent. It is possible, however, that the community members would not have understood the intricacies of the entire details of the project as it was mentioned even in the consent form. For example, simple things like micronutrients are impossible to translate into a local language. When you translate them, it becomes muqawwiyat, something that makes you strong, and over a period of time it becomes something like what would make your blood strong. Okay, a hematinic maybe. The other difficulty that one encounters, especially in communities like this, when one is administering an informed consent, is that you have to be very careful that the process of informed consent is administered to each and every participant the same way. And it is frankly impossible for any investigator to be aware of each and every instance. So what we then attempt to do as principal investigators is to make sure that our staff are periodically checked, both in terms of the way they administer those, also in terms of the number of refusals, because it would be impossible to find that there is a 0 refusal in a particular project. And if that ever happened, I would be very suspicious. So we keep tabs on it at regular intervals by spot checks, random checks of the consent forms, and random checks in terms of the audit numbers, number of refusals, people who refuse blood samples, etc. Periodically, what we also do is to go and speak to the community members to get their perceptions as to what had happened. In Ready Goat, for example, what happened once was that there was a problem with a couple of phlebotomists in terms of the way they were taking samples, and we got a feedback on that very quickly from the community, and we had to go back and renegotiate some of those technical aspects of the project with them. One thing that I do want to talk about is the difficulties that you encountered in an informed consent in our social setup by using placebos. And this is something that I have learned the hard way. And the reason being that it is firstly not very easy to administer the concept of a placebo to a largely rural illiterate population. Because the natural question comes, why are you using it? I mean, if there is no benefit in it for me, or even if it's a random allocation, some will benefit, others will not, it creates enormous misconceptions and hurdles. What some people do in that scenario is, frankly speaking, is not administer a true consent with a randomization to a placebo in the way it ought to be. Others have attempted to use analogies like firing blank bullets versus real bullets as one means of administering an informed consent in a placebo randomized trial. Over the years, what we have come to believe as a way forward is that even for a control arm, I think either an active placebo or some other agent which has some positive benefit to the community is probably a better way forward. At least everybody knows that they are getting something. Some are getting a little more than others, but even the control arm is getting something which is beneficial to them or to their children. To illustrate, in the micronutrient supplementation trial, our control arms are also getting some multivitamins. Maybe not the whole micronutrients, but some essential multivitamins which are important from a public health point of view. What that means is that you need a larger study. Then you need to adjust for that sample size. You need greater resources. And that is true, and that is a negotiation process with funding organizations. But in an essence, I'm more comfortable with a design like that than a true placebo where you give nothing.